Okay, so now on to hypocalcemia. So let's discuss again. So PTH, of course, it works to increase calcium and decrease phosphorus. Vitamin D will increase both, so I can't imagine we're going to talk a lot about it with hypocalcemia. And calcitonin is going to decrease both calcium and phosphorus. Now, I can't take credit for this amazing mnemonic. The person I used to work with, Katie Bowes, did. And so she came up with hypocalcium. There are other mnemonics, and there are actually numerous differentials for hypocalcemia, more so than these listed here. And I'm gonna go through all of these, but realize that we're only actually going to focus on a few of them that are more clinically relevant. All right, so I broke this up onto 2 pages. Okay, so the first, hypoparathyroidism. So you can imagine it's going to be the opposite of hyper. And so since PTH, and this is an immune-mediated destruction of the parathyroid gland, it's primarily seen in the dog. And what happens is we have low PTH, so this causes us to have low calcium, but we'll often have a high phosphorus, again, because calcium decreases while phosphorus increases. PTH normally increases calcium and decreases phosphorus, so the opposite occurs. So these guys will usually have a pretty low calcium. It's often going to be less than 6.5 or less than 7, even less than 6. If it gets too low, we can see really kind of excitable animals. They tend to have tetany. They can even have seizures. So that's classic immune-mediated. We can also see functional hypoparathyroidism, where our parathyroid gland doesn't work because of low magnesium. So low magnesium, we can see that in dogs and in large animals. Again, that was that lush grass resulting in both. All right, so so that's hypoparathyroidism. Again, the main one is the one we see in the dogs. Okay, the next one is my favorite. So this is blister beetles, and so the Y is for yucky. Blister beetles, and blister beetles are something that I don't know that we see it out as much here as we do out west, but blister beetles can get into hay, and they have a substance in them that is called cantharidin, and this cantharidin works in numerous ways where we don't really use blood work to diagnose this, but it tends to be very bothersome to mucous membranes. And so these animals present with urinary tract irritation, GI irritation, even hemorrhage, dehydration, very low calcium. We're not going to go into blister beetles very much. Something that we see commonly in small animal medicine, well, relatively, is pancreatitis. And pancreatitis, of course, is an inflammation of the pancreas. And if it's severe enough, we get what is called fat saponification, along with other things. But when this fat saponification happens, it essentially uses calcium to saponify the fat, and so you get a decrease in calcium. So other things that are going to support pancreatitis, well, you're going to look for an inflammatory leukogram, and you'll do pancreatitis under the GI section, GI pancreas section. So you're going to look for an inflammatory leukogram. Maybe the animal's vomiting, has a painful abdomen. They may even have a fusion potentially in the belly. They can be dehydrated, they can have injury to their liver, lots of things can happen. So big things for us are going to be an inflammatory leukogram now, vomiting, and a painful abdomen. Those are going to be kind of our clues. All right, the next one you've actually done in the renal section, and that's oxalates. And the big oxalate that we worry about the most, of course, is ethylene glycol. And I know everyone remembers what the crystal is. Yes, give yourself a second to remember. Calcium oxalate monohydrates. Of course, they look like a stake or a picket fence. Again, suburbia, death, picket fence, or a stake, vampires to kill. And so what are we going to see? Well, we're going to look for acute renal failure, often anuria or oliguria, at least late. So we're going to see azotemia, we're going to look for a high potassium, acidosis, etc. But what happens in this is that, so antifreeze containing ethylene glycol causes one of the byproducts of it, one of the metabolites actually causes mineralization, deposition of these calcium oxalate monohydrates within the body, especially the kidneys. And it uses calcium, so you see a decreased calcium. Of course, you're going to see an increase in phosphorus because of the acute renal failure and the decreased glomerular filtration. So this is something that we normally see, at least the ethylene glycol antifreeze in small animals. Oxalate-containing plants and large animals can contribute and can have some component. All right, so chronic renal failure, we're going to abbreviate it CRF. Some people, again, chronic kidney disease. And so with a loss of functioning nephrons, so you see azotemia, and we would expect it to be a renal azotemia. So you're going to look for a decreased urine-specific gravity. Maybe the patient will also be anemic. That might be the case, especially if it's been going on long enough, either from anemia, chronic disease, or a lack of EPO production. But remember that the kidney is very, very necessary for activation of vitamin D. We need the kidney for that, except in the horse. And so without this vitamin D activation, again, not the horse, you have decreased GI absorption, decreased renal retention of calcium, and so you become hypocalcemic. Also, your kidneys aren't good as resorbing calcium because they're not working as well. So that's another mechanism. So there's decreased vitamin D activation, there's increased loss, there's probably decreased intake because these animals aren't eating. That's another possibility. Other things, of course, you're going to see an increased phosphorus in these guys because of the decreased GFR from a loss of renal function. So in that case, you'll see an increased phosphorus. It can be rather high. These guys tend to get an increase in PTH. And this is what's called renal secondary hyperparathyroidism. And it's the low calcium, so it's this low ionized calcium that's driving this increase in PTH, and that's why it's called renal secondary hyperparathyroidism. We don't measure PTH in these guys, but if we did, it would be increased, and it's responding to the low calcium. All right, so the next one, of course, is hypoalbuminemia, and it could be any cause of a low albumin. Remember that half of calcium, well, almost half, we'll say around 45%, is calcium bound to albumin. And of course, this is part of total calcium. So if you have low albumin, you're going to get a decrease in total calcium. But this does not impact ionized calcium. So ionized calcium should not be affected. So we do not expect that to be the case. If ionized calcium is low, it means something else is going on. It has nothing to do with albumin. All right, so the next one is lysis. And in this case, we're talking rhabdomyolysis, which is muscle damage. And so why does this happen? Okay, let me draw you a muscle. Here's muscle, striated muscle, and there's my nucleus. And when you have muscle, right, so there's lots of ATP in muscle. And so this ATP in muscle, when the muscle dies, the phosphorus gets released, so you get a marked increase in phosphorus. And that causes a reaction with calcium that's in the blood. So calcium leaves the vessel and it binds to that dead space in the muscle, and you get mineralization. So that's calcium and phosphorus mineralizing. Phosphorus still stays elevated, and then calcium decreases. You also see, since potassium is very high in the cell, you're also going to see increases in potassium a lot of times. And this is rhabdomyolysis. What supports this is we look for something called CK, and the next lecture is actually going to be on muscle injury. All right, let's see. Oh, calcium binding anticoagulant. So this is not a disease. This means that you contaminated your sample with either sodium EDTA, potassium EDTA, or sodium citrate. So remember, how we anticoagulate blood, except for heparin, is that we inhibit calcium by our anticoagulants. So if we contaminate a sample that we don't mean to give an anticoagulant to, it's going to decrease the calcium. And it's going to be like the type of low calcium where you can't live with it. It's going to be less than 3. It's not going to be survivable calcium. So this is something that we see in vitro. If you use sodium EDTA, you'll see a concurrently high sodium. If you use potassium EDTA, you'll see a very high potassium. And I will call you, if you're the student, and I will say you contaminated your sample, and you will tell me that you did not. And I will know that the tube is not lying to me. So that's how we know that happens. All right, moving along. I, what is I? Ooh, intestinal intake. So intestinal intake or loss of calcium. And this is a big one because especially in horses, remember horses are very reliant on their GI tract to actually absorb calcium. So there's the horse GI tract. It's very, very, very long. And so they need to absorb a lot of calcium in their GI tract because they are not dependent on their kidneys. So any sort of GI disease in horses, especially diffuse disease, they can become hypocalcemic. Other animals, especially dogs with protein-losing enteropathy, so dogs with PLE, can have a low, that's supposed to be an L, can have a low calcium. And this is due to low albumin, and it's also due to decreases in calcium itself because of decreased intake and decreases in magnesium, which then further exacerbates the low calcium. All right, almost done. Okay, U means union with phosphorus. And this is that whole mineralization thing. So if your calcium times phosphorus product is greater than 70, there's some wiggle room, you can get deposition of calcium in tissue. And that's called, again, metastatic mineralization, even though it's a funny name. And the big sites, that's supposed to be mineralization, but my handwriting is terrible. So metastatic mineralization, we see this a lot in the lungs, we can see it in the kidneys, in the GI tract. And so in this case, calcium decreases, but phosphorus tends to remain high. So we see calcium coming out, but phosphorus tends to remain high. All right, the last cause is maternal. And I think this is a relatively easy one to understand. And so the big one we have to think about is going to be milk fever in cattle. They're, I feel like, the classic example. But since so many of us want to be small animal clinicians, we have to also think about eclampsia. And this is more often, we see this in small breed dogs, especially young dogs that are having litters, also known as periparturient hypocalcemia. So any of those, so it's related to pregnancy, often after they've given birth and they're lactating. And the cause, depending on the species, it's a little bit variable. So what's going to support it? Your signalment, certainly, and the history.